Hi, I'm Lisa MacLeod. I'm the MPP for Nepean. I'm a former Ontario cabinet minister. I'm a mother. I'm a wife. I'm a friend. And I'm also somebody who has mental illness. Over the number of past 6 to 10 years, I have been in and out of hospitals. I have been working with a variety of different doctors. And today, I'm here with a very special person, Dr. Rob Swenson. He is the first psychiatrist that I had the privilege of seeing at the Ottawa General Hospital. I was a patient of his for over 4 years, and I really owe him, and I say this with all sincerity, my life. And so it's good to have you, Dr. Swenson. Thank you for joining us.
Well, thanks, Lisa. And I mean, I'm really glad to be here. I really admire you for being so open about your experiences and also trying to help other people. And that's really, really helpful. I'm a retired psychiatrist.
Yes, I didn't say that.
Recently retired after 40 years. So yeah. I'm enjoying life. I'm a father of two children who are getting older. They're both married. So I'm really happy to be here. Thank you.
And you spent some time in the Ontario Psychiatry Association, probably the 40 years that you were a working psychiatrist in the system. You were on the OMA executive for 8 years, which was obviously very stressful, but also high impact. You worked at the Ottawa Hospital. I saw you at the General Campus, but you're part of that organization, particularly through some of the mental health changes that occurred. And you worked with the University of Ottawa Hospital. You're going on the board of Briere, and you continue to be active in the field of psychiatric by, I would say, doing some great mentorship with some new and up-and-coming psychiatrists.
Yeah, it's been my privilege. I've had, great years in the field of mental health. I've also been able to look at the broader healthcare system through my work with the Ontario Medical Association, and which is a huge advocate for healthcare and mental health care as well. So I'm happy to be here and happy to have had all these experiences and happy to have had you as a patient.
Yeah, thank you. Not many people say that.
No, it was a privilege.
Yeah. Well, one of the things I wanted to do was full disclosure, because I have played this life out and it wasn't by virtue of me wanting to, but my life is played out in front of a camera, in front of hundreds of thousands, if not millions of people. And because I'm bipolar, it means that, there were different versions of me that people would see at various times as a result of where the illness was going. And my first arrival to you was at the Ottawa General Hospital. I believe it's at the 6th floor. Is it the 6th floor? Is that the
We're 4th floor.
4th floor there, 6th floor
at the Civic.
At the Civic. I'm not ashamed of having had to go or still go to the psychiatric unit to get the care that I need. And I visited you. My staff drove me. I locked myself in my office or my house in Toronto for 3 days. And I don't know if I was psychotic, whatever, but I knew when I came out that I needed to see somebody. And we drove, my staff drove me straight to the hospital to see you. And I remember telling you the story, and we often joke about this, but it was so crazy what I had been going through that it didn't seem real. And I was going to bring a guest or a friend or a family member the next week. And then you read the headlines about what I've been going through, and you were quite shocked.
Well, I was. And Lisa has had a horrible experience, traumatic, as a politician, which affected her whole life and made her very frightened for herself, but her family as well. And it was such a bizarre story of persecution by people, devastating attacks on social media, and personally, she was in danger. And this story, and I've heard a lot of stories, just shocked me. And I wasn't even certain at the beginning, is this true or is it a delusion? And then it all broke. And I felt that a lot of your symptoms, even though you may have had an underlying bipolar illness, were due to trauma.
Yeah.
And I think it's important to be very accepting of people's stories, particularly if one doesn't know them as a healthcare provider, and not dismiss things
Yeah.
that are happening. And sometimes patients feel their doctors or other healthcare providers are dismissive, and they don't believe me, and that's devastating because you're
Yeah.
asking for help. So I think that's one of the things that I think is so important, is to believe a patient. Um, and sometimes they are broken with reality, but a lot of times they're not.
Yeah.
And one has to first accept that
Yeah.
this story has validity and tell the patient that.
Yeah, it was weird because you didn't just deal with me as a dignitary. You've had many. I mean, we're in the city of Ottawa. We're in the city of politics.
Yeah.
We're in the city of festivals, meaning we have like superstars coming here quite frequently. We have a major hockey organization in the NHL. So you've dealt with high-profile people before, and so was this something that was new to you? That level of dealing with a mental illness, but at the same time dealing with, I guess, PTSD, right? It was,
Well, I had never, and I've had several politicians, very provincially, nationally known, but I've never had and was aware of politicians who were harassed to the point of having threats and trauma. And is this new for politicians? Is it just being exposed? But since your trauma, and you've been very public about what you've gone through, other politicians have stepped forward. So I took care of a lot of politicians, but the underlying theme when I saw them was they felt ashamed. They felt this has to be hidden. They felt the stigma of their illness.
yeah.
And that made it harder for them to get better.
Yeah, and I think wanting to be better was absolutely critical. But I also went through a period where you had to, or my family had to bring me back to see you. And I'm thinking there were gaps, right? When I was seeing you, maybe through the pandemic. Maybe that was when I was getting a little bit, I don't want to say high like on drugs,
Yeah.
but high on the bipolar spectrum, where I thought I had it all figured out. And you said to me, I think it was a couple months ago, where you're like, yeah, it wasn't always like you wanting to come in. Like sometimes we had to get you in there. And then all of a sudden, I had to make my family physician had to make a very serious call to you. So can we just go through the stage? Because this is what I want to get into when we talk about other people, is that stage where I wasn't always available to the idea that I needed help.
I think when Lisa first came to see me, it was at the urging of your staff, family, and you at the beginning didn't believe that you had a mental health problem. You were uncertain whether you should come to my office.
Yeah.
And it was a very small little office.
Yeah.
Luckily, you came.
At least you didn't make me stay for a few nights.
Yeah, I did not. But I guess the most important thing, I think, is that a relationship between a doc and a patient, or a mental health care provider and a patient, is critical. And that relationship takes a bit of time. So, and I think the most important thing maybe I did do was reassure you, hey, no one's going to lock you up, Lisa.
Yeah.
Guess what? You're going through some rough times. I don't know you that well, but come on back. Let's talk about things. It's not going to hurt, and I'm not going to label you.
Yeah.
at the first appointment
Yeah.
because people are afraid to be being labeled. They don't want to see a psychiatrist in 30 minutes. You're bipolar, or you've got schizophrenia, or you better take these pills right away.
Yeah.
I think the relationship is the most important therapeutic tool.
Yeah.
And to reassure somebody that, hey, you're having a rough time. It's fine to come and talk about it. There's no labels right off the bat. There's no drugs right off the bat.
Yeah.
And that's true for 99% of patients. If there's an emergency, if a patient's suicidal or psychotic, things are very different because they really need emergency care, and that time to form a relationship isn't there. But overall, for most patients, seeing a mental health care provider, um, forming a bond, a therapeutic bond with their provider is most important for them.
Yeah, I like what you say, therapeutic, because I think when you're in, or you feel like you're in an environment that isn't safe, you want a place where and especially in my mind, it doesn't work like other people. So I need to be in a place where I can calm my mind and my breathing so that I can effectively communicate. And I know a lot of people say, well, Lisa, that's my thing, is I'm an orator, I'm a communicator, and you can do that. No, but to really sit there and tell you what's in my heart and in my head and what I need to explain, I need to be in a place where I trust and I feel safe. And in that particular point, I didn't feel safe. I didn't feel safe in public. I didn't feel safe in my own home. I didn't feel safe in the media. And I think the media has a role to play in terms of dealing with politicians with mental illness and how they characterize certain things. And then I didn't have any support in Toronto. I didn't have any support. And I don't mean just my family and you. I mean, it was as if man down, okay, we're marching on. And there didn't seem to be any kind of understanding from what we would call the center to protect my health.
Yeah, and I think that may be something that politicians have to improve upon. And I think it's a lonely game in many ways. And that's just my thoughts about being a politician, because you can't show your real self as a person sometimes to the media, and that your colleagues are basically hanging on to their images.
Yeah.
And if everything's an image, then where do you get real support?
I remember one of the things I remember from those sessions that we had was your absolute disappointment in that, or your shock that there wasn't more support behind the curtain.
Well, yeah, how would I know? But never done politics, thank God. But
there's always a second act. There's always a second act.
I would have thought that, hey, I'm Joe Blow, politician, and need to hang out. We need to be a team, because teamwork is important in healthcare. No one type of provider can do it alone. But I'm not so certain from what I've heard about politics that it's really a team sport. It's
a blood sport.
A lot of, I don't want to say that, but there's a lot of individual people with career aspirations and sometimes big egos.
Yeah.
And I do believe that politicians want to help citizens. I haven't lost that faith.
Yeah.
Most politicians anyway.
Yeah.
But I don't think you were getting the support you needed, and you're away from home a lot. And Toronto's not home. And
it was like I was always running, not for election, but running away. So trying to leave my emotions and my illness behind. And that became difficult. And then obviously I got into another depression. And it probably started in September, I would say, of 2021. Led me into the election. I wanted to quit, as you know, before the election, and we stuck through it. Everything was very difficult. And then I'll talk about the elephant in the room. On the 24th of May, I decided to take all of my antidepressants because I didn't want to live anymore. I felt like I was living in a fishbowl and I couldn't breathe. I had so many protesters. The police are always at my house. I was being bullied by some people internally, and it just became like, you know what? There's no point. Why do I even want to live? And I ended up at my family physician's office, and she called you. And I attribute my life, me being here right now, to the quick action of both you and Dr. Deutsch. And throughout that period, it was May 24th, 2022. I remember walking into the hospital after you guys, made the plan, get me well, get me healthy. And I remember saying, I am going to win this election whether I want to or not, and I don't want to. And, the poor kid running against me think he's got all this momentum, and I'm like not on the campaign trail for 2 weeks, and I don't want to win. And the poor guy's like, oh, we're going to put all these mean-spirited signs up, and the media is all buying into it, and none of them know what's actually happening. And so for the next several weeks, and my husband let the premier know that I wouldn't be returning to cabinet. I wanted to resign on the 3rd of June from the cabinet, and I was in no state. And you were literally for that period of time from then until the end of the summer when you retired. And I remember you kept telling me, I'm going to retire, I'm going to retire, I'm going to retire, and I wouldn't accept it. But you literally had to look at me and say, Lisa, you're not a cabinet minister. You're not an MPP. You're more than that, but you're not all of that. And I remember it was almost like you had to strip layers off of me so I could feel validated myself until we could start building those blocks up so that I could be well again. And that was a hard process, even though it was mostly just talk therapy.
And I guess my message to Lisa was, Lisa, you're a person. You're a human being first. You've got lots of aspects of your life and your personhood that have nothing to do with politics. You're a mom. You do grocery shopping. You've got a husband. If you lost your position as a member of parliament, you'd still be the person.
Yeah.
You have a family in Nova Scotia, and so you're so much more.
Yeah.
And I had to tell Lisa that constantly.
Yeah.
And in my office, she was a patient and a person.
Yeah.
I knew very little about. We didn't talk politics. In fact, I was very careful not to.
Yeah.
And because that was important, that Lisa start to understand she's a person and people matter and no one should end their life.
Yeah.
And not only that, I emphasized to Lisa that she had so much trauma through this harassment and persecution and death threats. So not too many people can go through that and not break down. So it wasn't all bipolar illness.
Yeah, it was a trauma too. And
oh yes, and I think it precipitated destabilization, and you may have been a bit bipolar, and there are degrees of bipolarity, but this trauma, I think, would do most people in, and it certainly was a big factor in.
Yeah, and then what weird thing about that is, because I agree, like I had been chugging along for a long period of time, that happens, and then the trauma, I think, sparked that, and then I've been going now through, well, I would say that since February I've been good, but I was cycling up and down, and sleep being a problem, and I've been very fortunate, that you when you retired, you handed me off to almost your doppelganger. Yeah. And, and I will say this, there's a lot of great psychiatrists out there, especially the young ones that are coming into the field. but there's nothing like somebody with experience who doesn't have to write everything down. They just look at you. You've identified the human emotion and circumstances for 40 years, and you just sit there and you know intuitively what someone needs. And when you retired, you found me the next best thing, and I'm.
Oh, I think
Yeah.
my colleague and friend is an excellent psychiatrist and very non-judgmental
Yeah.
and friendly. And I think people are afraid of psychiatrists. I don't blame them in a way. But friendliness in any doctor, and I go to doctors myself, and is important. You got to have someone friendly, not stiff and formal, and not feel you're being judged. And that's more important than any pill a healthcare provider dishes out.
Yeah.
Because the pills won't work if you don't have confidence in the doctor.
Yeah. Well, and so I want to go, and we were able to talk a little bit about me and my experience, and how you led me through some very difficult times and into recovery. And of course, my new psychiatrist is helping me with that now. But there's lots of other people that we want to reach, and I'm just wondering if they're going through a situation like mine. Look, they're not going to have major political parties, opposition parties, death threats, and the media on them, but they're going through trauma themselves. They might also be bipolar. They could be going through anything. What advice for anybody going through the feelings that I had would you give them in terms of getting help, or even just to calm down, to be in a place where they're making a solid decision? Because one of the things that I would do is I would try and make decisions that weren't necessarily in my best interest, just because I wanted to move on and not.
You wanted to get well.
Yeah, and I didn't
well.
want to just sit with
Yeah.
myself. So, any advice for people?
Well, I think if a person's lucky enough to have someone they can talk to, and that would be a partner or a family member or a close friend, then that would be the place to start. And my advice for the person is, you don't have to tell them everything, but you can say, I'm going through a rough time.
Yeah.
And get that conversation going. And for the family member who's worried about a loved one, or a partner who's worried about their partner, or a friend, establishing that communication and sort of not bringing you're mentally ill into it right away, but just trying to understand what the person's going through and normalizing it and say, a lot of people are going through a rough time these days. Let's just talk about it. Because if you can establish that communication, you can then be in a position perhaps to get them some help they need, or convince them to go and get help. But if you don't have that communication, you're not going to be able to do anything. So that's where it has to start. Non-judgmental, empathy, letting them know that, hey, you're not crazy. You're going through a rough time. A lot of people do that.
Yeah.
So that's important. If they and get the next conversation, book the next conversation. It's not just a one-shot deal.
Yeah, that's true.
You gotta sort of be prepared to say, well, let's get together next week over coffee, or let's talk about this again. We're partners. We need to keep talking until the person's ready to say, yeah, maybe I'll go and see my doctor, or maybe I'll go get some healthcare, or maybe I'll look at a website where there's information.
So just on that, do you know of any websites or numbers people could call? Because one of the things is you can get them to talk. They may not say a lot, and then they need help. But how do you approach that conversation? Is there any, or do you know of any resources?
Oh, there's amazing resources on the web. There's, in fact, I looked a lot of them up. the this morning before our talk,
Yeah.
the Canadian Mental Health Association has a great website. The CAMH from Toronto Centre for Addiction and Mental Health has fantastic information on their website. There are local websites. For instance, the one in Ottawa that I referred a lot of patients to that offers so many programs is Psychiatric Survivors of Ottawa.
Oh, wow, that's good.
And it's a fantastic organization. They've got drop-in centers. They've got groups for families. The National, and I go look at this up, the National Alliance on Mental Illness is a Canadian and U.S. organization.
NAMI, right?
Yeah, that often, has a lot of information and often has local resources. And they're often excellent for patients with mood disorder or bipolar disorders.
Yeah, I've been following them a lot. So, yeah. Apparently I'm textbook.
Oh.
Yeah, I get all the great stuff.
You know what? I don't believe in textbook patients.
Okay.
I think everyone's a person.
I know.
Person
that's
first,
why I love you.
then a patient,
Individuality.
then the last thing, maybe a label.
Yeah.
But person first.
Well, that you got me to that point.
A job is second.
Yeah.
A label is another thing. Labels can be very helpful to help guide treatment.
Yeah.
But you got to remember the person.
Yeah, I think it was helpful for me at the very, in the middle, because you helped me understand as an individual. And then the middle was like, okay, there's some level of acceptance here now. And it's funny because I never would have taken medication every day until they're like, no, like you need to take this every day. And so it's like, all right, the lithium, bring it. Lamotrigine, bring it. Escitalopram, bring it. Like I can handle all that stuff. So, so it's been helpful for me. But I mean, I ended up going. So what if you have these conversations, you've consulted the websites, you've made a phone call into a hotline, which by the way, we'll put all of them at the end of this segment, and the suicide hotline number will be underneath this whole segment, this whole episode. But what do you do when there is just flat out rejection of the notion somebody needs to see a doctor? And they don't have to be suicidal, but they could be in some way self-harming. They could be withdrawing and isolating themselves from, because I isolated myself quite a bit, but withdrawing from society. Like what happens then?
Well, if you're a family member or a friend, or you got to realize that you may not be able to do it all yourself.
Yeah.
And you've got to get some support yourself in this. So if it's a partner, well, maybe you need to ask for help in getting them help from other family members.
Yeah.
Enlarge the circle. And the other thing is, one has to realize one's own limitations as a friend, as a partner, as a family member. And sometimes a person suffering from mental illness needs to take the time to come to a conclusion. And this isn't true if they're out of touch with reality, of course. Then that becomes an emergency. But if a person's ill and they don't want help, if one can at least keep the communication going and not get angry with them and say, well, I'm frustrated. I've tried to help you. You won't take it. Well, too bad then.
Yeah.
Because that's a natural human reaction, to be frustrated, to be a little angry that they're not the person that you want them to be, they've always been.
Yeah.
And if you have a partner with mental illness, well, yeah, they're not the person that you may have married or joined up with. And yeah, they're going through a very bad time, and it's easy to be frustrated when they won't take help. And so one has to understand one's own feelings, and maybe talk to other people about how frustrated you are that so-and-so won't get help.
Yeah.
You can't, and it takes time.
Yeah.
And
are there any strategies that you would recommend you want to stay on good graces, but they may then become resentful because they view you as the enemy and trying to get them for help, but they're okay in their mind. Are there any sort of strategies where you can get them to sort of look at that experience as a helpful one? And I'm thinking, for example, say that I was not getting help. Everyone knew I needed help. I didn't want the help because I thought I was absolutely fine. And is there a way to sort of put something in front of me to go, okay, well, maybe, and to put reason back into my mind or anyone else's?
I remember that at the beginning, you agreed to come see me reluctantly.
Yeah.
But one of the things Lisa did was she agreed to come back. But I said, Lisa, do you have anyone you really trust that you can bring with you? And you brought a senior, assistant in your office or on your staff. She was lovely.
Yeah.
But I think it made Lisa feel less vulnerable when she knows that sitting beside her is a person she can trust, because she didn't know me. And so if a person's unwilling to accept help from yourself, let's say, well, then maybe talk to someone else and say, well, you don't believe me, right? It might be hard to talk to me, or, maybe you're angry with me. Is there someone else you can talk to?
Yeah.
Just go and talk to them and see whether they think there's an issue.
Now, I got a question I wasn't thinking about asking you, but I will. What do you do in the situation where you've had a friend or a family member really work hard at getting you to seek help? You don't for a while. Then you finally do. You go through the therapy, you take the medication, you start moving on with your life. How do you repair those relationships once you've identified that you've got a problem or had one?
Well, that's tough. And relationships are always two people or more, and sometimes the person who doesn't want to repair the relationship, they've cut off communication. All you can do is try. And all you can do is say, I'm in a lot better place.
Yeah.
Would love to, talk to you, or, just start that communication again.
Yeah.
One of the saddest parts about being ill, and it's not just mental illness, it can be physical, is people lose relationships.
Yeah.
And people with any kind of illness, have lost friends, family members, and people who are, terminally ill often are lonely because it's hard to go see someone who's terminally ill. It brings up all sorts of anxiety. And so sometimes relationships are lost because of illness.
Yeah.
Mental illness and physical.
Yeah.
And that's a real sadness about it.
Yeah, and I think too, the tough thing when you're a patient or you've got the illness, especially when you've got something like I do, like it can be either I can be euphoric and I can be on top of the world and I can be the most productive person in society, very charming, and then all of a sudden, it could be a couple days later, it could be a month later, I'm in bed, I can't get out, my mind is mush. And I call it my mashed potato brain. And, then everyone, so the question is like, who are you? And then the other question is, because you feel like in the moment, that's who your real personality is. But people then have an opinion of you. You're lazy if you're in bed, but you just can't get out. Like I've been there, like it's not fun. Like I don't want to be in bed. Like there's life out there, but I can't do it. And then there's the euphoria where I'm dismissive, I'm irritable. I think I'm so much better than everybody else. And you know what? I'm not, but I don't know it at the time, right? Like that's just so how do people deal with and I don't know if schizophrenia or borderline personality or whatever might be the same, but definitely when someone's in depression, that you deal with that. How do you become resilient as someone who is a caregiver, a loved one, a friend, and a coworker? Because let's remember, this all coming into these four walls, right? And because I've always been very honest with my staff, and I've been honest with the media, I've been honest with everybody, because that's who I am. But, you know, if someone doesn't have sort of my core personality, like, how do they explain that, and how do the people around them accept it?
It would be hard. On the other hand, I think what you've accomplished is developed a lot of insight into yourself. And so you're giving your staff permission to back off if you're not feeling well. Mm-hmm. You're saying, you know, I'm feeling lousy for the next couple of days. I need some time to myself. Mm-hmm. And you know what? If you are irritable when you're feeling better, you're the kind of person who'll go and apologize to your staff or, you know, your family. So it's important there has to be some understanding, but it's hard. It's hard for family members to be resilient. Yeah. It's hard for you to be resilient as a patient when you come out of feeling lousy and you realize I was super angry with someone and maybe it wasn't quite justified. Yeah. The other thing you've done, I think, is realize that in my more difficult times, and hopefully they're not lasting that long, I need, you know, to withdraw a bit, not to be super productive 100% of the time. Yeah. Maybe just 85% is good. Yeah. Yeah. And be kind to yourself. Yeah. And if you're kind to other folks and your loved ones 85% of the time, that'll allow them to make allowances. Yeah. Well, it's interesting. My family now seems to understand when the trajectory is up or down or going to plateau. So, which is interesting. We've learned those, and we've learned some of the other triggers that you know, are out there. But it's been, you know, I owe you. You did the work, Lisa. You were there holding my hand. Before we go, I do have a couple other questions, because you have been on the precipice of change a number of times in the healthcare system, particularly through the evolution of acceptance that this is an actual disease. And I don't mean just bipolar or PTSD. I mean mental illness writ large is becoming more of a focus, more acceptable to talk about at work, in the media, at home. And I'm just wondering, you know, you've been in the medical system, the hospital system for all that time. What can our hospitals be doing to keep up with the changing needs in society and the times? Because obviously, as the population grows, so does the need. And as people start to be open about their mental health, that means they are more likely to seek assistance. Well, as a person who's worked in hospitals for 40 years, I think hospitals have evolved. I think when I was a medical student and an intern and a resident, we weren't treated that well by other physicians. So there was a little bit of trauma, or sometimes a lot of trauma, getting through one's training. And thank goodness over the years, the mental health of healthcare providers has become a very important topic. And docs, nurses, physiotherapists, they work in a very stressful environment. So if the staff isn't treated well, I have some difficulty believing the hospital really wants to treat patients with mental health problems well. And that's not true today. But years ago, hospitals raised money by trumpeting the greatest technological investigation. We've got this operation. We've recruited this surgeon. The operating rooms need money because we're going to be the very best. But it was all technology and not about people. And so I think hospitals have evolved. And the reason they have is because the public's evolved and saying, we think mental health is a problem. We think hospitals play a part. And guess what? It's not good enough to have a back ward in the hospital with horrible surroundings for the so-called psych patients and not give them the care they deserve. And so I think hospitals have actually moved along because patients and citizens and governments have demanded it.
Yeah.
And so that may seem like I'm not appreciative of all the work hospitals do.
Yeah.
That's far from it. I was on the senior medical team at the Ottawa Hospital for a number of years as head of psychiatry, and I got a lot of support.
Yeah.
But there's been an evolution in the care provided by hospitals, and thank goodness for that.
One of the things that I've always wondered is how can the emergency rooms triage mental illness quicker? And I'll give you two examples. A friend of mine and myself have presented on a number of occasions to the ER. And this was prior to me seeing you. So it was, I would say 2014 to 2018. And I would show up. Queensway Carleton Hospital, of course, is my local hospital, as you know. And they have a beautiful mental health wing that they've just opened up. And very, very proud of that. But it seemed like they put me through so many tests with my heart and my breathing and my blood pressure, et cetera, when it really was a massive panic attack. And I almost wonder if they should have, before they put you through all those other tests, is there a mental health or is it impossible to sort of have that mental health check or mental wellness check to see if you can get your breathing under control, for example, or release that pressure that's on your chest? Because I always have said, and I said this to the former Deputy Minister of Health, like, it just seems to me, I cost, whenever I do that, the medical system so much more money than if they had just triaged me and diagnosed me appropriately.
And it's tough. And I've many, many years ago worked in emergency departments, when I was training as an emerge doc part-time. And emergency physicians have really developed through training and experience a better appreciation, I'd say, of the links between physical and mental health. But in an emergency room, the first order of business is to make sure a patient's not dying, make sure they don't have a heart attack when they're having chest pain. So it's often reflex that you do all the physical tests to exclude the most acute, life-threatening physical illness. Mm-hmm. But sometimes in all that, no one says, well, could this be a panic attack?
Yeah.
And this is Lisa's fourth visit.
Yeah.
And
it's always at midnight, right?
The chest x-rays and the ECGs have always been normal. And she appears highly anxious and difficulty breathing. So instead of saying you don't have pneumonia and you're not having a heart attack, go home, one can sort of say, are you under any pressure, Lisa? Yeah. And it's sometimes in an emergency room so busy that question isn't asked.
Yeah.
And sometimes it should be asked. And I think emergency doctors are much more aware of the links between mental health issues and the physical health, and are better trained and doing a far better job. Plus, there are urgent clinics at the acute care hospitals that are established. And I was head of the outpatient department at the Ottawa Hospital and established an urgent clinic.
Yeah.
And the goal was to see patients within 2 weeks of referral. And our only referrals came from the emergency room from emergency doctors.
Yeah.
So it wasn't like the emerge docs are not aware. And this clinic has been in existence for many, many years, and it's always overrun with referrals from our emergency rooms.
Yeah, it's tough.
So things have improved with hospitals. There's always room for improvement. It's a tough area to give holistic care in a short period of time, save lives, and recognize other issues.
Yeah, well, that's true.
I've got a lot of sympathy for it. That's why I went into psychiatry and not emergency medicine.
Oh, wow, that says something.
Yeah.
Well, what would you recommend to the province, too? I mean, one of the things that I feel like obligated to do is to talk about mental illness, because we are the folks that provide the funding and set the policy parameters and expectations for the public, and we're the ones that take the calls in our constituency offices. So I felt, and I think I said this at the top, how could I be authentic in supporting my constituents and those with mental illness if I'm not transparent about dealing with my own issues? And so I wonder if you had any advice for politicians at the provincial level or at all levels. And if you think that the Ministry of Health can do a better job at supporting frontline doctors and physicians.
Well, you're talking to a former board member of the Ontario Medical Association who's been involved in various ways with negotiations with the Ministry of Health over fees. And I'm not going to get into that, except to note that mental health providers, not only physicians, are often not as highly valued by organizations and governments in terms of remuneration. And it's not just we need to pay docs well, and sometimes it's important for the public to know that psychiatric docs are one of the lowest paid specialties.
Really?
Yeah. And the highest paid specialties are docs that do procedures.
Yeah. And
that's always been that way, and no government can suddenly reverse that. But on the other hand, we also need to recognize it's not just docs that are integral to the system, it's nurses.
Yeah. And
so I would advocate for nurses, I'd advocate for mental health, occupational therapists and social workers. And often, and I've been on budget meetings, too many, when hospitals have to cut.
Mm-hmm.
And our colleagues, the social workers and some nurses, are deemed expendable to save money. So governments have to understand that if they say to a hospital, we're not giving you any raise, and you find efficiencies, it means folks are laid off, nurses, social workers, and, the mental health departments are affected as much as surgery and medicine. And so we lose highly trained mental health workers in hospitals. So that's a message that I'm given to politicians and governments. Money doesn't grow on trees. It all comes from taxpayers. But sometimes the taxpayers are willing to accept that they have to pay more to get better health care.
Yeah. And
sometimes governments have to improve funding for police and roads and everything else. But healthcare is damned important to citizens.
Well, when you need it, and you've got the best when you need it.
Yeah. And I believe in our healthcare system. Yeah. In Ontario and in Canada as a country.
Yeah.
But that's my message to politicians is you got to advocate for health. And sometimes in elections, politicians of all types don't want to talk about health because that's the third rail. That's where things get nasty.
Unless they're giving lots of money, right? They
Yeah.
can walk through.
Yeah.
All right, and I appreciate that. So you've given a message to politicians. This podcast usually gets viewers from across Canada, and we have two different types of folks that watch. People who know they need help, but are afraid to, and they don't want to pick up the phone, they don't want to click, and get the help they need. And the other is a family or loved one or coworker, neighbor who's trying to figure out how to help somebody. Now, we've had in the case of both of those, actual family members sit together who are one or the other. But they're watching today because they need help. And you are hope for us because we've had advocates on. We will continue to support people that way. But your expertise and your time in the system is something people will really appreciate. So if you were able to look at a potential patient who's afraid to pick up the phone or make that connection on the chat box at the CMA, what would you say to them?
I would say if you're too afraid to ask for help, recruit someone that you trust to help you with that. Whether it's your partner or a friend, family member. If you're lucky enough to have a person you can really trust, they can often help. Just like Lisa's friend and senior staff member came with her because she didn't know me. She was probably a little afraid to go in my office. So if you're too afraid to reach out, well, then reach out to someone you trust. And maybe with that backup, you then can take the next step.
And just one more question. So what if we're looking at a mother who is just devastated right now? She's got a child that needs assistance, or a child who knows the parent needs assistance, or a boss or a manager that's looking and says, my assistant needs some support. What advice do you have to them to break that stigma and have that conversation?
Well, it's tough, and there's no easy answer, but establishing communication and not being judgmental and not being too authoritative. You can't force someone to make that call for help. So don't get angry, don't cut them off, and understand it takes time. And if you can give them that support, things may change because they may refuse the first time, the second time, even the third time. But if you've got that ongoing communication, you may be able to achieve success in getting them to reach out for help and show them different ways. Well, what about your family doctor? Why don't you just go and talk to your family doctor if you're lucky enough to have one?
Yeah.
Or what about this website? And sometimes young people, if you're a parent worried about their kid, find it a lot easier to talk with people their own age than a healthcare provider. So looking at some of the websites, there are kids' helplines, there are whole programs set up with peer support by young people for young people.
Yeah.
And that can be very powerful.
And they should take ownership. Like, there should be no stigma, there should be no shame. And I know it's easy for me to say that because I'm not in their shoes, but once you've taken that step, you can take it from me. It is empowering. So any other recommendations you have, or?
Well, I just wanted to thank Lisa for asking me to come here. And I mean, I really admire Lisa because she's done the work. She may have had some help from healthcare providers, a lot of help from her family, friends, and but she's done the work. And so thank you for being so open.
Well, thank you, Dr. Swenson. I'm very fortunate that I had an incredible psychiatrist, someone who is now I consider a friend. And I think somebody that I'll continue to appreciate and work with and celebrate life with for the rest of my life. So, my friends, this is the episode of Mental Health Mondays with Lisa MacLeod, your MPP. With Dr. Rob Swenson, who was my psychiatrist, spent time at the Ottawa Hospital, the University of Ottawa, the OMA and the Ontario Psychiatrists Association and the Psychiatric Association. And he was joining us today on a very important topic. We're very fortunate to have him, and we will make sure that you have access at the end of this program to the mental health resources that Dr. Swenson mentioned. And please know this, you're not alone. There are other people out there on the days that you find are too dark, they'll brighten it up. And I'm here for you. Many other people are here for you. So thank you again. Stay safe. And remember, you're not alone.